Welcome to today's YouTube lecture on stroke.
In this video, we will discuss the essential aspects of stroke, including its causes, symptoms, and treatment options. A stroke occurs when blood flow to a part of the brain is interrupted, leading to brain cell damage and potential long-term disability.
There are two main types of stroke, ischemic and hemorrhagic strokes.
An ischemic stroke occurs when a blood clot obstructs an artery or blood vessel supplying blood to the brain. This type accounts for about 85% of all strokes. A hemorrhagic stroke, on the other hand, results from bleeding within the brain when a blood vessel ruptures.
Although less common, it can be life-threatening.
Risk factors for stroke include high blood pressure, smoking, diabetes, obesity, high cholesterol, and a family history of strokes. Atrial fibrillation, structural heart disease such as patent foramen ovale, hormonal treatment, oral contraceptives, cocaine or methamphetamine and heavy alcohol consumptions can increase likelihood of developing stroke. Conditions that can trigger blood clot formation such as factor V ligand mutation, polycythemia and sickle cell disease can also increase risk of developing stroke.
Understanding these risk factors is crucial in stroke prevention.
Identifying stroke symptoms is vital for seeking immediate medical attention. Common symptoms include sudden weakness or numbness on one side of the face or body, difficulty speaking or understanding, difficulty swallowing, visual changes, severe headache, dizziness, and loss of balance or coordination. To help remember the stroke warning signs, we have the FAST acronym: face drooping, arm weakness, speech difficulties, and time to call emergency services. Time is of the essence when it comes to stroke treatment.
Proper diagnosis is critical in determining the type and severity of a stroke. Urgent CT scan of the head should be obtained to determine whether stroke is hemorrhagic or ischemic type and to identify affected areas of the brain.
Brain MRI can reveal brain lesions missed on CT scan.
A negative brain MRI essentially rules out a cerebrovascular accident.
Cervical angiography and brain angiography may reveal occlusion or blood vessel or aneurysms for which interventions might be necessary. CT perfusion scan of the brain can be performed to identify affected areas of the ischemic brain that are salvageable through clot retrieval known as thrombectomy or clot breakdown with medications known as thrombolysis. Electrocardiogram should be performed to identify abnormal cardiac rhythm such as atrial fibrillation. Echocardiogram may demonstrate blood clot within the heart or structural abnormalities such as patent foramen ovale. Blood tests such as platelet count, INR, liver function tests and basic metabolic profile may guide decision-making process when selecting treatment options.
For ischemic strokes, time is crucial.
Antiplatelet therapy with aspirin or clopidogrel should be started immediately. Intravenous thrombolytic therapy or mechanical thrombectomy can help restore blood flow to the affected area, reducing brain damage for those who present within 4.5 hours after onset of symptoms if there is no contraindication. Treating hemorrhagic strokes involves strict blood pressure control with antihypertensive, anti-seizure medication to prevent seizure and evaluation by neurosurgeon for possible surgical or endovascular intervention. Stroke recovery often involves a comprehensive rehabilitation program including physical therapy, occupational therapy, speech therapy, and other interventions aimed at maximizing independence and improving quality of life.